So this is a perfect lead-in for you to look at my vitals while we're trying to connect. First thing I want to do is thank Denise and her wonderful team at Doctors 2.0 for inviting me here. This is my first year here. It's an amazing event. It's a really fantastic collaboration between physicians and patients and all of the folks that make up the healthcare ecosystem. And I'm really excited to be able to talk here for a few minutes about what we're doing in the field of biosensors, clinically validated tools, and also, I think everybody's probably heard a lot of PowerPoints and videos. So I'd like to turn this into my 3 or 4 minutes, or whatever we have left here, into more of a collaborative opportunity. We're going to show a screen on the camera here that's going to allow everybody in the audience to vote on what you think the hurdles are around wearable consumer tech, and I'll kind of walk everybody through what I was thinking about when I came up with the 4 or 5 bits. And you can vote either by sending, because we're using social media so wonderfully here, you can send your answer to my Twitter, which is @SwissGator. I live in Switzerland, even though I've been practicing my American for 40 odd years. Or you can send a text, or you can go to the web page. So while we're kind of, I think what the crew's going to do is set up a camera that shows a visual of the screen. I want to tell you a little bit about the sensor. I don't often get the chance to show my chest in front of a bunch of strangers, but here we go. I'm wearing it. It's 10 grams. This is it. That's all there is to it. It's a plaster. If you're from Europe, it's a Band-Aid. If you're from America, I'm a very big proponent of cheap and deep. Very important. This is kind of what we think about when we think about this space. Deep technology, inexpensively. It does 8 vital signs that are FDA cleared, CE cleared, and NICHO cleared. This is one of the very interesting things about where we're at in this technology revolution around wearables. I'm invited to a number of wearables conferences, events, webinars, you name it. And I always, somewhere along the line mention, we're a wearable medical device. Very important. Because this is what I think the future of how we're going to approach patients being able to take charge of their own care in collaboration with clinicians. We need to use tools that patients feel comfortable wearing. Again, we like the Band-Aid plaster because almost everyone on the planet knows what a Band-Aid or a plaster is, so it's not intimidating. And then clinicians need to feel very comfortable that the data that's coming out of these tools is accurate. I think that's one of the big stumbling blocks currently in wearables is we're having a difficult time convincing clinicians that these are accurate measurements that are coming out of these devices. So if you would, tell me what you think. Or what is it that is preventing wearable medtech from becoming the norm? I like to use the word meta-sumer, because that's what I see happening if the future of healthcare is at home. We need to have devices and applications and technology. And by the way, our company does not make a platform. We do not create a user interface. What you see on the screen is our demo app. We love partnering with companies that understand the medical device space, that understand chronic disease conditions, that want to solve a chronic medical problem. So adoption, is it going to be adoption by clinicians and providers and payers? Someone has to pay for it. The patch is about 35 euros, but someone still has to pay for it. Is it compliance? Will users say, I don't know how comfortable I feel wearing that and having all this data about me transmitted, or I don't like the feel of it, or whatever it might be. I think one of the big problems we face today in Europe, the second leading cause of disability in Europe, is stroke. How do we know you're going to have a stroke? In most cases, you have it. That's how we know you're going to have a stroke. So, will you wear something if you're in a high-risk target group that will monitor conditions like arrhythmias and AFib and things like that? Sorry about walking in front of this. Regulatory, they use passing 3,000 amendments to health data laws. Will that be an issue? I can tell you it wasn't cheap for us as a startup to get our FDA clearance and our NICHO clearance, which is the Asian clearance. and the European clearance. And finally, will it be economics? How much will the devices have to cost for this to make sense? And what will be the value that's delivered? Very, very critical to us, having adoption. I come out of the technology business. I'm a reformed serial tech entrepreneur. And, we need to apply the same thoughts that we have in technology, Facebook, Instagram, Snapchat, you name it. They had massive adoption rates very quickly. And why? Because they deliver value at scale. So feel free to keep voting, and I look forward to hearing from the whole audience. Thanks a lot for your time.